Hi, a 12th standard student was brought to me once. The exams were 1.5 months away, and he said he could not remember whatever he had studied. He was anxious and distressed because of this. On clarification of history, I learned that his parents were allowing him to sleep for only 4 hours per night for several months. They will wake him up at 4 a.m. and make him study. I told the parents to allow him to sleep as much as he wants for the next 2 weeks. Father asked, "Are you not prescribing any medicines?" I said, "No. No need for any medicine for him. Sleep is the medicine." Welcome to Mindscape Matters, and I am your host, Dr. Mohan Raj, a consultant psychiatrist. This student, like several others, is undergoing what we call as sleep deprivation. Sleep deprivation is different from insomnia. Let me clarify. Insomnia occurs when you want to sleep, you give yourself enough opportunities to sleep, but you are not able to sleep. In sleep deprivation, you are able to sleep, but you do not give yourself opportunities to sleep. You prioritize other things like work, study, a late night party, or spending long hours on social media or watching videos. Insomnia can be seen as a symptom in many illnesses like depression, anxiety, and some other psychiatric illnesses. It can also be seen in any illness that causes pain or breathlessness. We need to find out the cause of insomnia and treat accordingly. Sleep deprivation, on the other hand, is voluntary. We inflict it upon ourselves. It has health consequences, both short term and long term. If you sleep less for one night, you will need to sleep longer for 2 or 3 nights to compensate. If you don't compensate for the sleep deprivation, you will face consequences. In the short term, sleep deprivation affects memory. One of the functions of sleep is to sort out the daily experiences that are in the short-term memory and move them to long-term memory or to let them slowly fade away. Short-term memory is stored in a brain region called hippocampus, and sleep helps to move the memory to the cerebral cortex where it is stored as long-term memory. This consolidation of memory is affected when a person sleeps less. There are many research looking at the short-term consequences of sleep deprivation on memory. As early as 1924, there was research on sleep deprivation and its effects on memory. These researches were replicated many times over the years and the results were the same. The protocol would be get volunteers who are having normal and adequate sleep, then divide them into 2 groups based on random numbers. Then one group is allowed to sleep for 7 to 8 hours and another group is allowed to sleep for only 4 to 5 hours. One of the research protocol is to teach the participants many facts on the day before their sleep. The next day, the participants would be tested to see how much material they are able to recall. It was found that the group that slept for 7 to 8 hours had a much better memory recall than the other group. Their sleep helped in memory consolidation. The group that slept for 4 to 5 hours had a much less consolidation of memory. Another research protocol is sleeping before learning. Here, the groups are divided as above, those who sleep for 7 to 8 hours and those who sleep for 4 to 5 hours. After they wake up, they are taught something. And then they are tested to see how much new memory was assimilated. That is, new learning was assimilated. Again, those with adequate sleep had better new learning ability than those who were sleep deprived. Using similar research protocol, it was found that sleep deprivation impairs a person's creativity and problem-solving skills. Sleep deprivation also affects a person's attention span and concentration. Another area that is affected by sleep deprivation is fine motor skills that is required for drawing, drafting, painting, or playing a musical instrument. These are all important aspects of anybody's life, including as students. Now, coming back to the student, his parents allowed him to sleep well for the next 2-3 weeks. He felt much better and reported gradual improvement in his memory. Thank you for watching this far. If you like the video, please spread the word among your friends. Stay tuned because Mindscape matters. Bye.